United States spends more on healthcare than any other developed country in the world. And you might think, of course you dumb, that's because they've got the most number of people. Good point, Robbie. Even if we calculate it per capita, the US spends way more than any other developed country. They spend about 17% of their GDP on healthcare. In comparison, Australia spends about 7 to 8%. For our 7 to 8%, we get universal healthcare. For their 17%, they get Grey's Anatomy to take tips from.
Somehow or another, Canada can provide universal healthcare to all their people, half the cost. UK can do it, France can do it, Germany can do it, all of Europe can do it. Gee whiz, somehow or another, we are the only major country on earth that can't do it. Why is that?
Oh yeah, I'm feeling the burn. I'm not even arguing this from a moral perspective. For my non-existent conservative audience, this way you get to keep more money in your pocket rather than give it to the evil government and live longer. The only way to make healthcare cheaper in the US is by making it free. I've got to explain two basic concepts of economics before I can explain why that is. First, healthcare is not an elastic demand. Elastic demand is for products that we don't need for survival and will only get at a reasonable price. Kind of like Justin Bieber's cologne. Do I want Justin Bieber's cologne? I desperately want Justin Bieber's cologne, but I'm not going to pay $200 for it when I know Harry Styles has a much more affordable cologne in the market. Second, economies of scale. This refers to goods and services that are produced at a much larger scale, causing the average unit price to reduce. Kind of like you going to EB Games and getting a GTA bundle pack. Even though you really wanted San Andreas because that's the best one, you bought the bundle pack because you knew it was a better deal. The way Australia or the UK is able to provide healthcare at a cheaper rate than the US is precisely because they have universal health coverage. Let's say you're a company that produces fake knees or fake hips. The offer that the Australian government will bring you is you need to provide us with a product that is safe, and you need to provide us with a product that is affordable. And if you can do these things, then your contract will be to supply fake knees to the entire country. That's a huge order. What company would want to miss on that? The US currently does not negotiate these prices collectively. Hence, the average unit price of their knees or their hip replacements is significantly higher. And because I don't want to live my twilight years in utter pain and misery, I will buy it at any cost you give it to me for. And then there's the issue of rising premiums. The reason why Obamacare became more and more unpopular towards the end of his tenure was that even though the government was spending billions of dollars in Obamacare subsidies, the premiums kept rising up. The reason why the premiums kept rising was because of the people that had signed on to Obamacare in the first place. These people were in desperate need of affordable healthcare plan, likely because they already had some sort of pre-existing conditions, which means that their likelihood of going to the doctor or getting a procedure done was much higher than the average citizen. So how do the insurance companies cover the cost? By raising premiums. Universal healthcare coverage can help solve this issue. If you've got a single payer system where the entire population is under one insurance scheme, you can have the people that don't utilize these services subsidize it for people that do. So if there's any Yanks watching, vote wisely. You're not going to get this opportunity for some time.
I will tell you what the issue is here. The issue is whether the Democratic Party has the guts to stand up to the healthcare industry, which made $100 billion in profit, whether we have the guts to stand up to the corrupt, price-fixing pharmaceutical industry, which is charging us the highest prices in the world for prescription drugs. And if we don't have the guts to do that, if all we can do is take their money, we should be ashamed of us.